Hello everyone, here I'll discuss about the gross features of thyroid gland. This section includes its external features, relations, blood supply, nerve supply and applied anatomy. Yes, coming to this location of this thyroid gland, see here, this is the anterior region of the neck. Up here you can see this one is the hyoid bone. Here you can see this is the body of the hyoid bone. This projection here, small one, that is the lesser corner. This is the greater corner. Here, this cartilage here, this is the thyroid cartilage. This S-shaped structure here, this is the thyroid gland. Inferiorly, you can see this is the tracheal rings, this is the trachea. Then here, inferiorly, you can see this arch of aorta. It's providing branches. That is the here left common carotid, left subclavian. This is the left aspect. This is the right aspect. See here the brachycephalic from this arch. It divides here into right common carotid, right subclavian. So in this lateral aspect of this gland, here you can see this is the internal jugular vein. Then this is the internal jugular vein. Here it's a subclavian forms this right and left brachiocephalic, then joins to forms this superior vena cava. Here you can see this is a common carotid artery, So this thyroid gland, it lies on the anterior and lateral side of the neck. It is highly vascular. Is the largest endocrine gland. Then here you're seeing this again, that is the anterior view of the thyroid gland. This is the anterior view. See, this is the hyoid bone, thyroid cartilage. This one is the cricoid cartilage. These are the tracheal rings. So this is the lobe. This is the right lobe. This one is the left lobe. Forms lateral lobes. Is connected to by this isthmus. This part is the isthmus of the gland, and it relates posteriorly to the C5 to T1 vertebrae. Okay, so then isthmus is related posteriorly to this second, third, and fourth tracheal rings. Here you can see this is the first ring. Can see here second, third, and fourth. Coming to lobes of the gland, this part is the apex. This is the base. Base is related to the fifth or sixth tracheal rings. Then its dimensions, the lobes, that is the 5 into 3 into 2 centimeters. Length is 5, breadth is 3, thickness, that is the 2 centimeter. The isthmus dimensions, that is the length is 1.25, breadth that is 1.25. It is 1.25 into 1.25 centimeters. So that about this position. Then here is seeing that is the anterior and posterior view of this thyroid gland. Here this is the anterior view, this one is the posterior view. So this you can see this is the thyroid cartilage, this is the cricoid cartilage. See the cricoid cartilage, this is the cricothyroid muscle. Here this is the thyroid gland. See this is the tracheal rings, trachea. In the posteriorly, this tracheal rings, this is filled with muscle. Here this is the trachealis muscle. Then coming to its external features, here this lobes and the isthmus. See, this is the right lobe, this one is the left lobe. This part is the apex, pointed one. This part is the base. Okay, this is the anterior border. Then surface here, the surface here is the anterolateral surface. See, in the posterior aspect, this is the ill-defined posterior border, relates to the superior and inferior parathyroid glands. So this surface here, this is the posterolateral surface. See this surface which faces towards medially towards the trachea, the surface here, that is the medial surface. So features, this is the apex, this part is the base, this is the anterior border, this is the posterior border, this is the anterolateral surface, this is the posterolateral surface, and this is the medial surface. Yes. Coming to this coverings of this capsules of this thyroid gland. Okay, this is the frontal section. Here you can see this epiglottis, interior of the larynx, interior of the trachea. This is the thyroid cartilage, cricoid cartilage. These are the tracheal rings, you can see. This one, this is the right and left lobes of this gland. So this glandular part is supported by this fibrous part. So this stroma of the gland, the fibrous part of the gland, condenses to form this exteriorly, form the true capsule. Okay. Outer to that, there is the pretracheal fascia which lines this gland. Okay, that is the modification of this deep cervical fascia. So that forms the false capsule. So false capsule, true capsule. Then inner to that, you can see this is the venous plexus are there. This is the venous plexus. So during the removal of this thyroid gland, that is the thyroidectomy, this thyroid should be removed along with this true capsule to avoid hemorrhage. Yes. Here this is the ligament of Berry. Here this again this is the anterior view. See, this is the thyroid cartilage, cricoid cartilage. This is the tracheal rings. This is the right and left lobes. See the medial surface. This is the medial surface towards facing medially. Then there you can see this ligament here. This is the ligament of Berry. It's the condensation of this pretracheal fascia. It's condensed medially and is attached to this cricoid cartilage. Cricoid cartilage here. This one is attaching to this cricoid cartilage and tracheal rings. Okay, this is the reason why during deglutition, that means swallows, this thyroid gland also moves up and down. Okay. Then, coming to this relations, each surface relations, the borders relations. First, here this is the anterior view. The anterior view. This is neck here. This is the hyoid bone. See the clavicle here. This will get the sternum. Here they can see this is the thyroid cartilage. This is the cricothyroid muscle. See, this is the thyroid gland. Thyroid gland. So anterolaterally to this thyroid gland, it's related to muscles attached to this hyoid bone. These are the infrahyoid muscles. These are the infrahyoid muscles. So this is strap muscles of this neck. Superficial and lateral, you can see this muscle. This is the sternocleidomastoid. Middle to that, this is the sternohyoid. Lateral to that, this is the omohyoid. Posterior to the sternohyoid, deep to this sternohyoid, there will get, this is the sternothyroid, and this one is the thyrohyoid muscles. Okay, so this is the isthmus. So here we'll get the lobe of this thyroid gland. So this apex is relates anterolaterally to the sternothyroid muscle, and behind there is a posteromedially will get the inferior constrictor muscle of pharynx. Okay, so apex is between this sternothyroid and studded between the sternothyroid and this inferior constrictor muscle. So during the enlargement of the thyroid gland, this thyroid won't extend beyond this level, won't extend above to this level. Other than this, these muscles forms the anterolateral relations. Okay, that is the sternohyoid, then sternothyroid, this omohyoid, sternocleidomastoid forms the anterolateral relations. Then here you are seeing this is the lateral view. This is the right lateral view. This is the thyroid gland. This is the right lobe of this. This is the thyroid cartilage. This is the right lobe of this thyroid gland. See here, you can superior and inferior parathyroid glands there. See here, this muscle, this is the inferior constrictor muscle. Then here laterally, you can see this is the common carotid artery. This is the common carotid artery. This one is the internal jugular vein. This is the vagus nerve is there. This enclosed in a tubular sheath that forms the carotid sheath, which is also the thickening of this modification of from this deep cervical fascia. So this carotid sheath medially will get this common carotid artery. Laterally there is this internal jugular vein. Middle will get this nerve, that is the vagus nerve. Okay, that forms the posterolateral relations. Then here you are seeing this is the posterior view of this gland. See here posteriorly you can see this is the inferior constrictor, that is the pharynx. This one is the esophagus. Anterior to that will get here, this is the trachea. So this is the right aspect. This one is the left. Okay. Here this is the arch of aorta. This is the left common carotid, left subclavian, brachiocephalic trunk, right common carotid, right subclavian. Here I can say this is the internal jugular vein, common carotid, and vagus nerve is there. Okay, see this vagus nerve here. The vagus nerve superiorly it is providing, this is the one branch, that is the superior laryngeal nerve. See it from here it is providing one branch, that is the recurrent laryngeal nerve. It hooks around this subclavian artery here in the right aspect and ascends through the tracheoesophageal groove superiorly. In the left side, see, this is the vagus nerve. See the vagus nerve. It is providing one branch here. This is the recurrent laryngeal nerve, left recurrent laryngeal nerve, that hooks or winds around this arch of aorta, then ascends through the tracheoesophageal groove. See here, you can see this one is the recurrent laryngeal nerve. Then medial surface of this thyroid gland relates to this trachea and this one, that is the esophagus. Trachea and the esophagus, medial surface. Then here you are seeing this is the cross section, transverse section to the thyroid gland. This is the posterior aspect. This is the anterior. This is the right and left. See here, this is the thyroid gland, that purple color one. Then it's surrounded by this fascia, that is the green, this covering, that is the pretracheal fascia. Then this is the anterolateral surface. See, this anterolateral. This is the posterolateral surface. Okay, this forms the medial relations. So anterolateral surface relates to the sternocleidomastoid. Then you can see this is the sternothyroid. Then here this is the omohyoid, and this one, this is the stenohyoid, and this is the sternothyroid. Okay, here you can see here this is the sternocleidomastoid. Here you can see this is the sternothyroid, then stenohyoid, and this one is the omohyoid. Then this posterolaterally, see the posterolaterally, it relates to this structures in the carotid sheath. That is the, here you can see this is the internal jugular vein. Then this is the common carotid artery. Then this one is the vagus nerve. This one is the internal jugular vein. Okay, that forms the posterolateral lesions. Then medially can see the, here that is the medially, here you can see this is the trachea, and this one, that is the esophagus. Then coming to this blood supply, that here is the arterial supply. See here, this is the common carotid artery. Here you can see its division. This is the external carotid artery. From this external carotid artery, this branch is coming to the superior of this thyroid gland. This is the superior thyroid artery. This is the superior thyroid artery. It divides into anterior and posterior branches. Okay, see in the upper border of the isthmus, the superior thyroid artery of each sides anastomose with each other. The upper border of the isthmus. Okay, then see the lower aspect. This one is the subclavian artery. From this one of these branches of the subclavian, this is the thyrocervical trunk. From there, this inferior thyroid artery is coming. See this inferior thyroid artery. It is going through from the base to the posterior aspect of this thyroid gland. Okay, it's going towards the posterior aspect, this inferior thyroid artery. There, here, you can see this neurovascular relations artery, and this nerves relates with that. See here, this is a thyroid gland. This is the apex. This is the base. This part is the isthmus. So this one is the common carotid, external carotid, internal carotid. From this external carotid, see the superior thyroid artery is coming. It is providing anterior and posterior branches for the corresponding surface. So this one is the subclavian. Here it's providing, this is the thyrocervical trunk. From there, this inferior thyroid artery is coming. Inferior thyroid artery is going to this posterior. See, this is the posterior view. You can see here, this is the thyroid gland. See here, you can see this is the inferior thyroid is going to this posterior aspect. Okay. Along with this artery, one nerve is also there. Okay, from this vagus, which hooks around with this subclavian and this arch of aorta. This nerve here, this is the recurrent laryngeal nerve. So this recurrent laryngeal nerve and this inferior thyroid gland closely relates to the base. Okay, it's closely relates. So in the superior aspect, here this is the nerve here. This is the external laryngeal nerve. Okay, So you're seeing the superior laryngeal now of this vagus divides into external laryngeal and internal laryngeal. So this is the external laryngeal now. It's along with this artery, that is the superior thyroid artery. Okay. So during this ligation of this superior thyroid artery, during this removal of this, during the surgery of this thyroid gland, okay. So the superior this thyroid artery should ligate close to this thyroid gland, close to this apex superior thyroid artery, to avoid injury to this external laryngeal nerve. Okay, should ligate close to this gland. To ligate this inferior thyroid artery, see this inferior thyroid artery, it should be ligate away from the gland. Okay, it should be ligate away from this gland to avoid injury to this recurrent laryngeal nerve. See this recurrent laryngeal nerve, it should be ligate away from the gland. Okay, to avoid injury to the recurrent laryngeal nerve. These are the relations of this nerve and artery leads to the thyroid gland. Then coming to this venous drainage, here this is the thyroid gland, this is the anterior view. You can see here this is the internal jugular vein. Along with this arteries, veins accompanies. So this is the superior thyroid vein, drains into this internal jugular vein. There is a middle thyroid vein, drains into the internal jugular vein. See here from this inferior thyroid veins. So lower border of the isthmus is relates to this inferior thyroid veins that drains into this brachiocephalic veins. So that's about the venous drainage. Then coming to this nerve supply is through this sympathetic and parasympathetic. That is the parasympathetic to this branches of the vagus. Then sympathetic, that is from the branches from the superior, middle and inferior cervical ganglion. Actually, the secretions of the hormones of this thyroid gland are under the influence of the pituitary gland. Then here you can see this lymphatic drainage. See here, this is the thyroid gland. Here you can see this is the prelaryngeal lymph nodes. Upper part drains into this prelaryngeal lymph nodes. Lower part drains into this pretracheal lymph nodes. From there, final drains into this deep cervical lymph nodes. That is to the jugulodigastric and jugulo-omohyoid nodes. Here we are seeing this the thyroid gland. See this is the right lobe, this one is the left lobe, this is the anterior view, this part is the isthmus. Here you can see the pyramidal lobe, this is the levator gland thyroid. See this is the apex of the lobe, this one is the base, this forms the anterior border. See the anterior border, the surface is the anterolateral surface. Okay, so its length is somewhat, this is average of this 5 centimeter. Yes, that's all about the gross features of this thyroid gland. So here is the question. Describe the thyroid gland. Under this, about this external features, its true and false capsules, then its relations, blood supply and applied anatomy. Thank you.